From KETK, you're watching East Texas Live.
Well, welcome back to East Texas Live. Joining us now is Dr. Timothy Beck with Azalea Orthopedics, and today we are talking about total ankle replacement surgeries. Good morning. Thank you for coming on.
Morning.
All right, perfect. So what is your specialty at Azalea Orthopedics?
My specialty is primarily foot and ankle orthopedics. I do some knee surgery also and knee evaluations, but primarily it's foot and ankle orthopedics.
All right, so you're one of the few surgeons in Tyler trained to perform total ankle replacement. Can you tell us more about the procedure?
Absolutely. Ankle replacement surgery is very similar to most joint replacement surgeries. The concept is that you have a worn out arthritic joint that is painful and stiff, and we go in surgically and remove the arthritis by cutting it out and put in medical grade metal and on each side of the joint, and plastic or polyethylene between them to restore the joint motion and function to help with pain relief.
All right, perfect. Sounds like definitely a necessary procedure for some. So what are some of the main indicators that a person would need a total ankle replacement?
Ankle replacement is indicated for a painful ankle that has documented evidence of arthritis. Usually it's associated with stiffness, sometimes deformity. So the patients who come in with a painful stiff ankle that is x-rays show arthritis, it's an option. There's other options also, but that's one of the ones that is very much more in vogue right now.
All right, so you're talking about options. So how does this procedure, how would it benefit a person's life after the operation's done?
The surgery is meant to improve the patient's function and their pain. The replacement is a big surgery, and no doubt that it's something that shouldn't be undertaken without quite a bit of consultation and consideration of what the other options are. But with successful joint replacement in the ankle, the patient should expect resolution of most, if not all, their pain. If they have deformity in the ankle, we can correct that at the same time. And as increased function, as increased pain, you restore function to allow them to be more active and do the things they want to do without having pain.
All right, so definitely something that folks may want to look into. So can you tell us about any new innovations that your specialty is offering?
Well, ankle replacement is not that new. It really was reinvented about 20 years ago. But the reason that it wasn't popular prior to that was that they weren't working well. And some doctors that were much smarter than me figured out what it was, and they redesigned the different implants. And so even though ankle replacement is not new, the reintroduction of that as an option for ankle arthritis is relatively new. And I see quite a few patients on a daily basis who, when I talk to them about their ankle arthritis, don't even realize ankle replacement is an option. The old standard of refusion of the ankle is a great surgery to help with the pain, but it doesn't allow the motion that a replacement does.
All right, so yeah, definitely something that some folks may want to look into. So before I let you go, anything else you'd like to say about Azalea Orthopedics or anything like that?
I hope that anyone who has an ankle problem that could be ankle arthritis, that they would look us up and give us a call and make an appointment.
All right, perfect. Well, thank you very much for being with us today. We'll get more information about them posted on our website. That's KETK.com. We'll be right back with more East Texas Live. Stay with us.